Hello, welcome. My name is Amy Carr. I'm the Vice President of Recruiting here at Worldwide Health Staff Solutions. And today we are joined by a very special guest. Jess Lyon is the Market Director of Nursing Operations at MercyOne. And we are so excited to have her with us today to talk about MercyOne. We have interviews coming up very soon. What an amazing way to start off 2025 with a USRN interview with MercyOne. So we're going to talk a little bit today about why it is a great place to work, why you should consider an interview. And for everybody who is watching us today, we are happy to take questions. So put your questions in the comments. Also, we'd love to know where you are watching from. So please introduce yourself and tell us where you're watching from. And just a note before we turn this over to Jess, this is an opportunity today for nurses that have already passed the NCLEX and currently have at least 2 years of current nursing experience in the unit that they will interview for. So those are the requirements. You must have already passed the NCLEX and also currently 2 years of nursing experience in the unit for which you're interviewing in. So welcome, Jess. Let us turn it over to you. We're so excited to hear from you and all the great reasons to work at MercyOne.
Thanks, Amy. I'm super excited too. Very excited to meet all of you. I'm really looking forward to seeing in the chat where everybody is from. And just really excited about this opportunity that we have to bring over nurses from all over. I'm seeing as I'm looking at the chat, you guys are all over. So yeah, we can go ahead and get started. So just to talk really quick about MercyOne, like Amy said, we are here in the United States. In Iowa, we have a hospital here, and our mission, vision, core values are also one of the reasons, honestly, that I am here at Mercy. I've been here for almost 15 years now. I've been a nurse for a lot longer, 20 some years. But these things, these missions, values, and vision, these are some of the reason that I stay here at Mercy. So our mission, we, MercyOne, serve together in the spirit of the gospel as a compassionate and transforming healing presence within our communities. I think that it's important to point out that MercyOne is a Catholic organization, and you'll see a lot of verbiage in our mission, our core values, and our vision that really talks to this, the fact that we're proudly Catholic and proud to really carry out, if you will, the gospel. Next slide. So our vision as a mission-driven innovative health organization, we will become the national leader in improving the health of our communities and each person that we serve. We will be your most trusted health partner for life. Next slide. And then our core values: reverence, commitment to those experiencing poverty, safety, justice, stewardship, and integrity. One thing that I love about our core values is that they're all very actionable. So I like things that aren't just a bunch of words and a bunch of fluff, but there's a lot of actions behind these core values. So next. Reverent care and integrity for all. I think that this really, as it says at the end, this is our one purpose, and it really does sum up who we are here at MercyOne. As a part of a sacred healthcare ministry, or sacred Catholic healthcare ministry, MercyOne Diversity and Inclusion Council operates with a team approach to remove barriers, address patient needs, uplift and understand our communities while providing radically convenient and personalized care to everyone. It's our one purpose. Next slide. All right, so when talking about MercyOne, we are part of it's a big organization. It's not just this one hospital here in Des Moines, but we are we're a whole center, right? We're a whole lots and lots of locations. So we have over 4 million patient visits to our organization every single year. We have 230, over 230 care locations when you count all of our hospitals, all of our surgery centers, all of our urgent care and clinics. We have over 230 locations. So just because you're coming here to us initially in Des Moines at MercyOne Medical Center, you have a career path to many other places, and depending on your skill set and your interests, there's lots and lots of opportunities once you get here. Over 22,000 colleagues over all of these sites, and lots of benefits. So 200 million plus community benefits, everything from education and community health services, charity care, unreimbursed Medicaid costs, going back to our core values. This is why MercyOne is so great. We have that benevolence mindset in our ministry. Next slide. So some of the benefits to you coming in as a colleague to MercyOne, competitive compensation package. So we really do, we look at this and we take this very seriously here at MercyOne. There is a whole compensation team actually that evals how competitive we are within our market, and make sure that the compensation that's being offered is competitive, is attractive to you. Insurance, medical, dental, there's vision insurance, there's insurance for life, all of it can be rolled into one big package. We do pride ourselves here at MercyOne in having a really great insurance package for our colleagues. Generous paid time off for rest and recharge. We think that this is super important here. We know that healthcare right now is hard. It's really, really hard. We're asking our colleagues to do more all the time, and it's super important for us, for our own health. It's also super important for our patients, that we're getting the rest and the recharge that we need. So one thing that MercyOne does is they have very generous paid time off. The vacation package is actually based on the amount of hours that you work, but there's also just some loaded time off for holidays, for sick time as well. So you'll definitely have the resources to be able to take time off to recharge so that you can get back to taking care of those patients. Tuition assistance, career development support. This is something I have taken advantage of here in my tenure at Mercy on several different occasions, actually. When I first started here at Mercy, I was an ASN nurse. Mercy helped pay for my bachelor's. They helped pay for my master's. They're actually helping me right now pay for my doctorate degree as well. So very very easy as well for to use this benefit package. Housing allowance and the sign-on bonus that you see next on the screen. These are going to be important for you as you as you make it over here to the United States. This is going to be what you need to start. And I don't know, Amy, if you need to, do you need to say anything more about the housing allowance?
Yeah, let me just sort of say a couple of things as people our comments are coming in.
Oh, sure.
So one, that the housing allowance, that's $5,000. That's towards your 30 days, your first 30 days of temporary housing. So MercyOne will cover your first 30 days of housing in the U.S. And then the worldwide team will help you both manage finding somewhere for the first 30 days and then finding your permanent housing. And then the $10,000 incentive bonus is a sign-on bonus that also goes along with the offering. And I see somebody asked what the hourly rate is for MercyOne. And I think maybe the good news is there's not just one hourly rate. So every nurse who gets an offer from MercyOne is going to have their individual rate calculated based on the location and the department, and also their current years of experience. And so it's all going to be individual offers that are exactly the same as any nurse that's working domestically in the U.S. So I think that part is really exciting. And so, like I think I just mentioned that there's not a specific offer hourly rate for ICU. I think it will be based on years of experience. So that's something that if you were to receive an offer from MercyOne, you would get your own hourly rate in that offer. And I think, Lucy, the housing, I think will probably be arranged on your behalf for 30 days of housing. And that $5,000 will go towards that. Great questions. Some of these I'm going to hold on for the question part. So maybe let's move on to the next slide.
Perfect. So about Iowa. So we are currently recruiting for Des Moines, Iowa, and West Des Moines, Iowa. So here in the Des Moines area, we do have two campuses. MercyOne has two campuses. Our Des Moines location, which we call Maine, and our West Des Moines location. And just a few statistics, I guess, about Des Moines. We have population in the Des Moines area of just over 200,000 people. It is a very young city. So we've been on lots of lists, if you will, for up and coming cities for young families to live in. It says here that the median age is 34 and a half years. The one thing that I love about living in Des Moines is that it's a larger town. It has everything that you need within the metro area. However, our average commute time from one end of the city to the other end of the city is less than 20 minutes. So no matter where you go in the whole metro area, very short commute time as compared to other locations. Our unemployment rate is really low. We're at a 3% unemployment rate. Fairly inexpensive to live as well. That's one of the nice things about living in the Midwest in the United States. We're smack dab in the middle, and it makes for a very inexpensive way of life, if you will. So about $170,000 for the median house price. If you're paying rent, average monthly rent is around $1,100. Let's see, looking here at our average highs and low temperatures, I was just telling Amy that I don't want to tell you guys how cold it is right now. We're sitting at 5 degrees according to the temperature right now, Fahrenheit. But really mild, very mild temperatures. We do have all 4 seasons, so we get snow in the winter, and lots of sun in the summertime. Some of the reasons to live in Des Moines, again, I said, affordable cost of living. We do have a lot of opportunities for your families as far as jobs go. Vibrant arts and culture scene, so true. We do have a very diverse population of people as well. So we have a lot of culture fairs, art festivals. Our Des Moines downtown, especially during the summertime, you can find all sorts of things to do to keep you busy, keep you learning. Lots of excellent schools and educational opportunities, all the way from our littlest of children all the way through universities and colleges here as well.
Yes. Somebody had a question about
Yeah,
snow.
sure.
Can
Oh,
you just talk? I mean, I think and even where I live in Charlotte, in North Carolina, we don't get snow very often unless you're in the mountains.
yeah,
So can you just talk about like how snow impacts or doesn't impact daily life in Des Moines?
sure. I think that we do. So we definitely do get snow. I will say that right now, we're at the beginning of January and we don't have any snow on the ground. We're brown right now, no snow. But we will get snow. And it does, there is definitely some impact. The nice thing about, the weather system is that we always have we always know when it's going to snow, so we can make those preparations for getting last minute groceries, or for making arrangements to travel to work or to school, if you will. It doesn't slow down living too much, because we know that it's coming every single year, I think. I would say that, on average, we get a couple of inches at a time. There have been some times, where you can have up to 8 inches, I guess, in a snowfall, but that doesn't happen often. We'll have snow on the ground for a couple of weeks, perhaps, and then it'll warm up and it'll melt off, and then maybe we'll have another couple of weeks where where we don't have any snow. So it's really off and on. It's very rare that we would have snow on the ground for the whole winter, because, again, like I said, we are pretty mild, and even when we do get cold, like right now when it's 5 degrees outside, it's gonna warm back up. So by the weekend, we're looking at 30 degrees again. So the snow wouldn't stay if we had it.
Awesome. Thank you.
Yeah, for sure. But with the snow, I mean, comes all sorts of opportunities for being outside, and lots of recreation. So our summers, for sure, people are outside all the time. We've got lots of biking and hiking trails around us. A couple of lakes here in the Des Moines area with lovely trails and parks. And then, we're just out and walking. The nice thing about Des Moines is that it's super safe to be outside. It's very family friendly to be outside. Let me see what else about Des Moines. Super strong sense of community. I think that you'll see see that not only just in the Des Moines community, but I would say that we really see that carrying over into MercyOne, into the hospital environment as well. That's one of the things that I love about working here at Mercy is just the family feeling, and I think that that's just part of the culture of living here in the Midwest. We actually have a saying here in Iowa about being Iowa nice, and you're just going to find that everybody goes out of their way to make you comfortable and to make you feel at home. Next slide.
And I think I'm just going to say that is true. That's it. We can go to the next slide, but it is true. The Midwest nice thing is it's absolutely a lovely place to visit. And I think if you're looking for somewhere where you can get to know your neighbors and get to know people that are in your hospital, and you're looking for a great place to raise children, or even if you're by yourself and you want to make sure that you have a sense of community, I think that like the Midwest is a great place to start your life in the U.S. Okay, so here are some of the positions that we are hiring for. Marvin asked about this a little bit earlier. So we are hiring for med-surg, tele, ED, NICU, critical care positions, which involves ICU, PCU, women and children, which is some labor and delivery, and also pediatrics. And then procedural, which are some roles in surgical services. There's lots of other questions about what kind of positions we're hiring for. And so today, these are RN positions that are currently working in bedside and have passed the NCLEX. So I saw some questions about medical technologists and nurse aides. We do have some medical technologist positions that we're hiring for, but it's not MercyOne. We're happy to help you. Please feel free to apply and we'll get you connected to a recruiter. We are not currently hiring for nurse aide positions. So if you're currently working as an RN in your home country, we would encourage you to really try to take and pass the NCLEX. It is the very fastest way to get here to the U.S. So that would be my encouragement to you if you're working as an RN in your home country now. And then I think, do you need current bedside experience? Yes, you do. And in fact, for every position that we're hiring right now, all employers are looking for current bedside experience in order to interview. And then I saw some questions about processing time. So this is for an EB3 visa, so a green card visa. This is not for H-1B. The current processing time for EB3 petitions from the time that it's filed until approval right now is somewhere between 9 to 12 months. And then the whole process from the time your petition is filed until you arrive in the U.S. is about 18 to 24 months. That's just the current processing time. As you all know, I'm sure that the visa bulletin comes out every month. We watch it just like you do. Follow us on social media to get the updates as soon as we have them. We post as soon as we see it come out. But just know that the I-140 petition for the EB3, you can put your family on it for children up to the age of 21, your immediate family members, and they can come with you when you come to the U.S. So they don't have to wait. So if you add your family, they can come. All right, and then for other questions, we'll hit you at the end. I just thought I'd take some of those right now. Okay, so maybe next slide.
All right, you guys all probably want to know this. What is it going to cost to live in Des Moines, right? So, again, one of the very nice things about living in the Midwest is our low cost of living. So if you're looking at, I guess you can see the breakdown here on the screen, and we do have a comparison there with San Francisco, California metro area. So if you're looking at just yourself as one adult with no children, no family coming with you, housing is going to be, very inexpensive at roughly $800 a month. Food, just over $300 a month. You're not going to have any expenses for childcare. Transportation of around $1,000 a month. Healthcare is going to be inexpensive as well, about $400 a month. Other necessities, $400 a month, incidentals, and then taxes at almost $600 a month. So gives you a monthly total of about, $3,600 a month. If you are bringing a spouse, a significant other, and a couple of children with you, you're going to see here that your housing goes up a little bit. You're going to need a little bit bigger space. Your food is going to go up some. You're going to have that child care expense that comes with having children that are not of school age, especially. Transportation might go up just a little bit as well. And then your health care and insurance costs will go up significantly. So from $3,700 a month to about $8,500 a month or so. But when you're looking at a comparison between us in Des Moines and San Francisco, it's hard. You can't hardly hold a candle to it. So
Yeah.
San Francisco, you're looking at a large sum of money to live there.
I think maybe just sort of one thing to think about, like even if you just look at like the housing number. So, for a family in California compared to Iowa, it's like 2/3 more expensive to live in California. And so when you get your hourly rate on your offer letter, if you have friends that are in California or New York City and they may have an offer with a higher rate on it, it is unlikely that it's going to be 2/3 higher. Right. And so I think one thing that's really important to think about is, this is a place where you would end up with more money in your pocket, which is really important as you start off your life in the U.S. You want to be able to build your savings and buy a house and all those other things that you dream of along with your American dream. And this is a place where you would be able to do that.
That's a great point. Next slide.
All right. So lots of questions about when are interviews. Interviews are next week. We are scheduling interviews right now. Interviews will take place in the morning time, U.S. time, from Tuesday to Friday. So if you're interested, if you have already applied, great. Please contact your recruiter and let them know that you watched this webinar today and that you would really like to schedule an interview, and they'll be able to look at your experience and help you get an interview scheduled. If you have not applied, please go online and apply right now. We will be more than happy to get connected with you and see if we can help get you on the MercyOne interview schedule. Also, please take a peek at your spam email box. Sometimes our emails go there. So please make sure you take a look at that. And we are so happy to help you get scheduled for an interview. We've got members of our team that are gonna be in Des Moines next week with the MercyOne team. So excited about that. We're excited about our time to be there and to help with the interviews. Okay, so a couple of questions. Maybe let's move into Q&A. There's a bunch of questions that have come in. So there's a couple of questions about does this offer include premium processing? It does not currently include premium processing. Premium processing right now today does not speed up your immigration process unless you have a current priority date. And if you have a current priority date, then we are happy to work with MercyOne to help provide premium processing, because it will speed up your immigration process. But right now, the current process is, it's taking a long time just to get through the process. So it's just not beneficial. There's a couple of questions about, are Genesis and MercyOne the same company? Jess, are they the same?
They are actually, yeah. So we both have the same parent company, which is Trinity Health. So Genesis in Davenport, Iowa, just recently, just this past 2024, joined with Trinity Health, and is now part of, back on that slide, of over 230 locations. They're part of us now. So yeah, we're super excited to welcome Genesis.
That's awesome. So, and Genesis, how far away is Davenport, Iowa from Des Moines, Jess?
About 2 hours to the east.
Okay. So by car, and we've got lots of folks who are currently in process with Genesis.
Oh, okay.
So if you are in process with Genesis and you have a friend or family member that you would like to be close to you, this would also be a really great place to refer them to, because it would be 2 hours driving by car. Yeah. It just as a reminder, in the U.S., almost every single person has a car. So, that's part of being prepared to come to the U.S. is really thinking about getting a driver's license and, a car and all those things. And our relocation team has some really great resources to help with all of those. Okay, a couple of questions have come in about the contract. This is for 36 months. It's a 36-month contract. However, it is a permanent position. So at the end of 36 months, you are welcome to stay as long as you're doing an awesome job as a nurse. And I think we hope that we find a really great long-term match between the folks that we hire for MercyOne and the nurses, and that they're happy there. There are many, many people who we have met in our partnership with MercyOne who have been with their organization for a long time, which is an amazing sign. And we hope that for all of the new additions that we find next week. Okay, next question was about staff accommodations. Are there staff accommodations at the hospital? And I think the answer is no. I think it is not traditional in the U.S. for there to be accommodations for nurses at the hospital. However, our relocation team is so happy to help you find accommodations. We'll help you with temporary accommodations and permanent accommodations. But that is something that almost all nurses in the U.S. find on their own. Somebody requested, I think, contact information. Just to note, all of the contact information for if you are selected, if you want to go through this process, like the worldwide team will help support you all the way through the process until it's time for you to arrive, and then we will connect you with MercyOne. So if you have questions or anything that we somehow missed or we didn't answer in this, please make sure you contact your recruiter and then your case manager, and they will be so happy to help with any questions that you may have. And I think also one question was about nurse to patient ratio, and it depends on the individual unit. So there are different nurse to patient ratios for each unit. That is a fantastic question to ask your recruiter, and also to put on your list to ask when you talk to the interviewer. Great question to just learn a little bit more about their day-to-day work to see if it's a good fit. So we do have that information, but it is different for each group. So happy to help there. And then somebody asked, why does this require the NCLEX? In the NCLEX is a requirement to file an I-140 petition for an RN for an EB3 visa. So that is a requirement by USCIS. And so that is why it is a requirement for this interview process. And then I think there was a question about NICU specifically, and do you have to have a higher level NICU degree? And the answer is no. You have to have an RN degree diploma and experience currently working in the NICU. would be the requirements. Now, that is a very competitive area. So I think, those interviews will be very competitive. So the folks that have the best experience will be the ones that are going to get the interviews. Another question was about license endorsement. And do we help with licensure? And we do. We have a licensure team at Worldwide that will help you with all the steps of endorsement or whatever the steps are that you need to take. And we are more than happy to help you through that. Okay, there's new questions that came in. Is PTE accepted in Iowa? Yes. In the state of Iowa, they will accept a visa screen in lieu of an English exam. And so any exam that is accepted by the visa screen will be accepted for licensure in Iowa. So that is great news. And then I think I already mentioned, we right now at this time are not hiring for nursing assistants. We are hiring for RNs and medical technologists. And we do take diploma nurses. We do. And the minimum experience for this is 2 years of current bedside experience. We do have some employers where it's 1 year, but for most of these positions, it's 2 years. Okay. I think I've answered the questions. Oh, here's a new one. Will you be sponsoring the English test or just reimburse? So MercyOne will reimburse you when you arrive in the U.S. for your visa screen. That's what they will reimburse you for. The visa screen and the medical exam. They will not sponsor the English test. Do British trained nurses need IELTS? It's actually about your education. And so if you're educated in a country that's not primarily English speaking, then you will still have to take the English exam. We don't have an age limit. In the US, you cannot discriminate for any candidates for any hiring roles based on age, sex, gender, religion, any reason. And age is on the list, so there is no age limit. You know what? The IELTS score, I do not have in front of me what is required for the visa screen. But that is a really great question to ask your recruiter, and we would be so happy to get that information to you. And do you accept OPD experience? Not for these positions. We do have some employers that will, but not for these. Not for these. These need to have acute care current bedside experience. Questions? So many excited people. That's so fun. Maybe we'll give a last call for questions. I think we've answered everything in the comments. While we are waiting, let me just remind everybody to like us on Facebook. We do fun events like this all the time and have special guests like Jess from employers and talk about immigration and nursing in the U.S. and all kinds of things. So make sure that you like us on Facebook in order to get all of our current updates. We also have an amazing Refer a Friend program where you can get $250 when your friend's petition is filed. So refer your colleagues and family members and make sure that that you are able to bring them along with you to the U.S. And then there's a couple of more questions, and then maybe Jess will go back to you for just final thoughts and what you want to leave these nurses with. Okay, any interviews for nurses who already passed the NCLEX? Yes, almost all of our interviews are for nurses who have already passed the NCLEX, and these are two. When you say bedside experience, more in a hospital experience. For these positions, it definitely is hospital experience. Absolutely. And then if your priority date is current, how long should I wait, years or months to process? Well, if your priority date is current, then I think really it's about how long the NVC is taking to process. When there was no retrogression and all of the priority dates were current, we would say the process would take 12 to 18 months. So my guess would be it's probably somewhere in that range if your party date is current. And do you accept med tech without AMT? All the med techs have to have either the AMT certification or another similar certification. That is a requirement. Is there a minimum hospital bed capacity requirement? I don't think there's a minimum hospital bed capacity requirement. I think, when we try to match people up with job interviews, we want to put people in roles where they're going to be very successful in the U.S. And so I think that in successful in the interviews with the employers. And I think that happens most often when the jobs are similar. So if somebody works in a high capacity ED today, then that's a really good candidate for a high capacity ED in the US. If somebody works in a very small ED, it would be a very hard transition to the US to a fast paced ED. So I think that's part of when we help decide with you what's going to be a really good fit and what's a good interview. I think those are things that we take into consideration. Home care bedside, I think it depends on the home care. I think it's great to connect with a recruiter, and we can learn a little bit more about what your experience is like. In some countries, home care is not very acute. It's much different, and sometimes it is really acute. And so I think that those are it really just depends. Okay, some of these questions I think we have answered. OET, PT, and ELTS, those are all acceptable in Iowa. And there are OR slots in the procedural group for this. There are certainly some surgical services. Second year nursing student. No, you would have to have already earned your nursing degree and taken the NCLEX for this. All right. So I think that there are some of these other questions that have come in would be really great for your individual recruiter. Some of them are like really specific and so hard to answer without having actually looked at your experience. But that's why we have a team of amazing recruiters to help connect you with great employers like MercyOne. And so I think let's hear just final thoughts from you on what you want to leave this very interested group of international healthcare folks with.
Yeah, for sure. I have been very impressed with all of the interest that you guys all have. Looks like there's a ton of great experience out there, and really looking forward to the next week when we are able to really get to know you a little bit more in the interview process. I think that you're going to meet a lot of really cool folks here that will be doing the interviews here in Des Moines, and I just am super excited and looking forward to bringing some of you guys on here to our MercyOne family.
And thanks again, Josh, for your time today. We know you're busy, and we appreciate you taking time to talk about MercyOne. And just a reminder for anyone here who is interested, interviews will go fast. So please make sure to reach out to your recruiter or apply today. We would love to help you get connected to MercyOne. And thank you, everybody, for joining. So nice to have all of the comments and all the questions. And wherever you are in the world, we hope that you have a wonderful week and we wish you a good morning, a good evening, or good afternoon. Bye, everyone.